Hi, in this video we'd like to talk about why bed rest, pelvic rest and medication is ineffective for the treatment of cervical insufficiency. So cervical insufficiency is one of the few causes that can lead to a late miscarriage, which can happen between week 12 and week 28. Late miscarriages are incredibly rare, but if they do happen, cervical insufficiency is the common cause. And it's entirely preventable and treatable if you do a prenatal checkup, or it can even be treated during early pregnancy. However, a lot of doctors would like to recommend bed rest, pelvic rest, and also prescribe vitamins, pills to actually help you stop this cervical insufficiency, when in actuality, in reality, it does nothing to stop the dilation, causing this premature birth or the pregnancy loss. Because cervical insufficiency is an organic disease. It is a weakness in the cervical muscle. So medication and bed rest will do nothing to stop the cervix from continuing to dilate prematurely. So these types of conditions require surgical intervention. Only surgery can effectively treat this and also stop pregnancy from ending in a miscarriage. We can preserve the pregnancy, have a full-term pregnancy, and also give birth to a healthy child. So the cause of the cervical insufficiency is usually due to previous surgeries of the cervix. For example, you've done a pap smear, a LEAP procedure, and some surgeries involving the cervix that can lead to this cervical insufficiency. In rare cases, some patients are actually congenitally, they are born with this condition. Furthermore, symptoms are very rare as well. It's a painless, silent pregnancy symptom, so it's very hard to catch it during the act. So usually when we diagnose, it's usually a patient with history of late miscarriage caused by cervical insufficiency. However, if in the case it is actually caught early during a pregnancy, then here at Antai Hospital we can actually provide treatment for these sorts of patients. So Antai Hospital's management for cervical insufficiency to prevent a late miscarriage is primarily we will recommend you to do this before pregnancy, so the entire pregnancy journey is a smooth one. But if it is found out during a pregnancy, hopefully it is first trimester or early second trimester, surgery can still be done, and we also still provide a full contractual treatment for our patients during this time. So if you still miscarry after treatment, then we will offer you a full refund guarantee. So for those who are in a much more later pregnancy stage, much more closer towards labor, and then been diagnosed with cervical insufficiency, we can still do this surgery. However, it is much more riskier, and we cannot guarantee success. We must ensure that the inner orifice is already open, but the external orifice cannot be open. Otherwise, it is very likely that the amniotic sac will burst, it will rupture, which means the water will break, and at that point, it will become an inevitable late miscarriage. So treatment is simply applying a cervical ring, anti-cervical ring, right in the inner orifice, not the external orifice. This is where conventional treatment is doing it, in the external orifice. So we want to do it in the inner orifice, and there is no stitches, so there's no bleeding, no infection, and it is easily removable during labor. So this is how we do things differently, and it also comes with a full refund guarantee. Success rates are high, and your late miscarriage can be prevented. Get in touch with us today via the website, and also leave me a comment down below.